questions about this part of the body, this cervical region? We know this is challenging, this region. It's hardcore, and congratulations how you manage this. It's equal like in Switzerland or in Germany or in Austria. It's the same level. I'm very happy. I thought it would be different, but it's like it is in physiotherapy. Not every person is on the same level, but it's a very high level. It's perfect. Teach with you. Thank you so much. Okay.
Before we start, there is a question maybe.
Yes.
스쿼트처럼 목에도 특정 움직임을 통해서 테스트한 방법이 있으신가요? 목에도요. 어깨처럼 스트레칭이나 로컬 스테빌라이저 이런 걸 전체적으로 목에 효과를
네, 뭐 그런 거라든가.
목에도 있어요. 액티브 테스트랑 패시브 테스트를 말하는 거예요. 네, 있어요. 요 책에도 뒤에 보면 평가 파트에서 보면 하는
여기서
나중에 할 것 같은데.
He asked if there is a specific active test to fascia test like a shoulder in exam.
I didn't understand. Is there a test for?
Yeah, like a shoulder part. There was some other test like.
Yeah, we have this procedure for the test, and the question is also in this region?
Yeah.
Yes, this is next what we will do.
다음 주제는 하도록 하겠습니다.
I'm very happy about this question because this makes absolutely sense to us. Do we have also an overview examination for the neck region?
네, 저한테도 아까 잠시 전에 제가
It's the
물어봤는데
next topic.
자, 어버브 유제네이션을 우리가 오해할 거라고 얘기를 했었고 그 다음에 그 선생님께서 이제 이거 굉장히 방금 그림 선택하는 거는 어려운 거를 알고 있고 자기 개인적으로는 자기가 가봤던 모든 나라에서는 일단 어려운데 한국 물리치료사들도 어려워한다는 걸 알게 돼서 나름 기쁘다고 합니다.
Yeah, that's great. But before we follow this course, we have to see there is our possibilities to support us in the anatomy knowledge, and I saw some of you have this software, and this is, I think, very, very helpful. When you have such a tool, you can repeat and see, oh, here superficial, this must be the sternocleidomastoid, superficial first layer, this must be trapezius. Between these first level muscles, there are second level muscles, splenius capitis, and then you can say, okay, please go away, sternocleidomastoideus, please go away, trapezius. Then you see the muscles of the second layer, splenius capitis and cervicis, and deeper as the second, there will be the third level muscles, semispinalis capitis, semispinalis capitis pars lateralis, and you can arise these second level muscles, and then you have this third level muscles here, semispinalis, and if you want to go deeper, you have to click away the third level muscles, and you say, please make space, and then you have here the fourth level muscles, which we spoke about now, and so you can go closer or less close, you can turn. I feel this is very, very comfortable to use such a tool. We can use this also in contact with the patient because many patients are interested, and if I don't feel very safe, I just or not, I can ask the patient in Switzerland, are you interested? And what I will do, I will show you the muscles, and then you take a book or you take such a tool, and then you can repeat yourself before treating. And this is a very good situation because the client, the patient sees, oh, you are interested, the patient is interested, you look together and then you practice it. And so you have a formation during your work and how to learn these things. I practice this like this. I showed the patient the book from Joel and Simons with the referred pain patterns like this, and so I repeat it again and again. So use this support. It's not possible to know everything. We have tools which helps us.
일단은 요거는 아틀라스타 아실 겁니다. 자기들이 이런 것들을 사용하는 것을 굉장히 적극 추천하고, 이번에는 우리가 배운 게 있으니까 다음을 쓸 때는 이제 목에서 첫 번째 층, 두 번째, 세 번째, 네 번째 층 걷어가면서 책을 보고 한번 추천하고요. 자기 같은 경우에는 이제 환자가 만약에 뭐 내가 어떤 치료를 하는지, 이 치료사가 나의 어디를 만지는지 막 불안해하거나 혹은 자기의 치료하는 방식에 대해서 어떻게 그 방식 자체에 흥미를 갖고 있는 환자들한테는 자기가 직접 이걸 보여주면서 또 설명을 하기도 한다고 합니다. 그래서 환자가 자기한테 어떤 문제가 있는지, 뭘 해야 되는지도 이해시키기 쉽다고 합니다.
Okay. And now to the screening tests of the cervical spine, overview examination.
자, 이제 경추에 대해서 오버뷰 examination을 배워보도록 하겠습니다.
And it's very, very simple for the cervical region. We make just 6 movements.
6개 움직임으로 구성된 간단한 검사입니다.
In the overview examination, we make flexion and extension. We make rotation to one side and to the other side, and we make lateral flexion to one side and to the other side.
굽힘평, 이렇게 한쪽으로 돌려보고 반대쪽 돌려보고, 한쪽으로 단축 굽힘, 반대쪽으로 해보고.
The interpretation is if it hurts with flexion, you get pain in the neck, in the head. Which system will be responsible for this pain? When I say which system, I think about the fiber direction. We have 3 fiber directions: the straight system, the U system, and the A system. And so the analysis of the screening test is it the problem for the A system, or for the U system, or for the straight system? Okay. So if you have this flexion, it will be a problem in the straight system. So I reflect which muscles make part in the straight system.
스트레이트 시스템을 구성하고 있는 근육.
Semispinalis. And so you have to treat primarily semispinalis muscle. If you make like this, you go back, then you think it could be a problem.
어떤 문제를 생각해 보실까요? 처음 할 때 통증이 있었나?
SCM.
SCM, it could be, but it's seldom SCM. Why? A muscle under a functional view has main movement aspects and subdominant movement aspects. And the main aspect for the sternocleidomastoideus is which movement?
Rotation.
For the SCM is rotation. So the SCM would give first a sign in rotation and not in extension. It supports this movement, this is sure, but it's not the main component, and because it's not the main component, it's seldom that it gives the symptom in this provocation. So if I make this, I think on the muscles before, on the anterior part of the neck, and this would be.
자, 일단은 SCM도 될 수가 있습니다만은 이런 검사를 할 때는 완전 주된 작용을 기준으로.
Yes, it could be longus coli, longus capitis, which would be how to treat in the next, of course, or it could be the scalenus complex, scalenus anterior, but also the other part, but primarily the scalenus anterior. Scalenus lateralis is more for lateral flexion, and it could be supra and infrahumeral muscles. And to distinguish this, it's very easy. You say it's different for you in this and in this position. And if this changes, you know it's supra and infrahumeral muscle and if it doesn't change, it's not supra and infrahiatal muscles. The supra and infrahiatal muscles make also part of the second part of the course. Okay, so when you make, we go first to the lateral flexion. You have lateral flexion, then arises the pain in the neck, in the head. This is a sign for
어떤
scalene and
어떤 거 있죠? 스컬링이요. 주된 적인가? 여기서 했을 때 이렇게 통증이
there is yes, levator and trapezius. All three are provoked in this testing maneuver, and then it's very easy. I spoke just once a little bit about this. If this hurts, we don't know, is it a stretch on the trapezius, levator, or on the scalene? And then you say, please lift your shoulder. And if then the pain goes away, you know there it's not a problem from the scalene, it's a problem in the levator or in the or in the trapezius. But if it remains, or he said it goes away, and you think it could be a scalene's problem, then you lift the shoulder and you say go further with the lateral flexion, because the trapezius and the levator, they limit the movement of the neck, and then you can't provoke the scalene, because first there is the irritation of trapezius and levator, and the scalene aren't enough provocated if the shoulder is here. So if you want provoke really the scalene, you have to lift the shoulder, and then you go in lateral flex.
네, 가축 굽힘에서 이제 트라페지우스랑 레베토랑 스크리니우스랑 구분을 하기 위해서는 이렇게 가축 굽힘 상태에서 슈러킹을 통해서 감별을 할 수 있다는 내용을 다시 한번 설명했습니다.
Okay. Now to the rotation. If there is a rotation, a problem to the right side, and there is a problem of pain, or has somebody of you a problem, or do you feel something strange if you turn the head to this or to the other side, then we can make a clinical demonstration. Please turn the head to one side,
자, 한쪽으로 돌려보세요.
and then to the other side.
반대쪽으로도 해보고.
Is there something strange for?
뭐 이상한 점 있나요?
Who does feel something?
Did you talk about the pain or
Yeah, pain, or just a feeling of it's. I can go further because it's strange. Often it's not a real pain, but it's an irritation you feel. On this side it's free, but here it hinders me something. It's not a big pain, but it's a limitation.
네, 통증이 있든 통증 없는데 그래도 뭔가 차이가 느껴지는데
You
뭔가
feel
이상한
something?
거.
Okay. Might we use it as to explain? Please come here.
이쪽으로
Okay. So please turn your head to one side
한쪽으로 돌려보세요.
and to the other side.
반대쪽으로도.
Okay. And when do you feel uncomfortable?
어디가 불편하죠?
Turn it to this side on the right side. Please make it again.
다시.
You feel the same irritation?
Yeah.
Once again. Yeah, okay. You see, I test the test every time, because sometimes you make it 3 times and the 3rd time you don't feel it anymore. Then you can't use the test. So this is first thing. What do we will next?
자, 다음에 했던 거죠.
Passive test.
As passive test. Huh? This is great. So please turn your head again to the side.
다시.
You feel it? Okay. Then you rest where you feel the irritation. Then the therapist goes here. You feel it now or not? go in the position, you can feel it.
이렇게 하는
Okay. And now I have to be aware in which position is this. And we go away from this position. Do you feel it? No. And you see, it's just few, 5 to 10 degrees. This is enough because it's an end range pain. And then you try to release. This is the most difficult part of the thing. And then me, a therapist, I turn. Do you feel it now too or not anymore? No. Okay. What do we know?
어떤 걸 할 수 있죠?
It's a muscle in which system?
active.
In the active system. And now I have to analyze which muscles are active or not on the left side because it hurts on the left side. And now, after 20 years of experience, I propose you just to ask one question. Is it the U system, yes or no?
자, 여기서 액티브 시스템에 문제가 있는 걸까지는 알게 되었습니다. 그 왼쪽에서의 애들에 대해서 느껴졌기 때문에 왼쪽에 있는 이제 액티브 시스템에 대해서 생각을 해봤는데 여기서 질문이 V 시스템이 포함됩니까 안 됩니까?
Okay. Please turn with a chair. Just that the group don't have to change more. And I don't learn this because my mind is so irritated. But I am on the left side and I know the muscle from the U systems, they are from here to here. I make this like this and then you have pain turning like this. And I see, is the U system active, yes or no in this movement?
Yes.
Yes, it's clear. I don't have to think. I can see it. So I know, yes, it goes together. So I feel it, I see it. And I know in your case, the problem is in the U system of the left side. Great. And next step is to know which muscles participate in the U system. Do you know?
V 시스템을 갖고 있는 게
Thank you so much.
스프레니어스 캐피티스.
Splenus capitis, splenus cervicis, and obliquus capitis inferior. Please write this down. This is important. This is to know. This is to learn. There are 3 muscles which perform an action in this U system. Splenus capitis,
저도 원합니다.
splenus cervicis, and obliquus capitis inferior. And this is very good to note, to write down. And if you are in your practical work and you see it's a problem in the U system, you take this sheet of paper and you look at these 3 muscles. Okay.
저도 보면 바로 딱 알 수 있으니까 저도 있을 거야.
근데 질문 하나.
Is it okay one question right now?
No?
No.
저도 있다.
And if you see it's a problem not in the U system,
만약에
it's possible it could be not a problem in the U system,
V 시스템이 아닐 수도 있는데요.
then you have to treat all other muscles. But not these 3. It would be wasted time to make it. So there is a clear distinction. U system muscle, yes, or U system muscles, no. And if it's U systems, you go on the splenus capitis, splenus cervicis, obliquus capitis inferior. And if it's not the U system, you would start first with sternocleidomastoideus. Because it's a rotation provocation, and the rotator, the mobilizers are away from the point of turning. They are away. And you would start with an examination by palpation from the sternocleidomastoideus, and if you wouldn't find there anything, then you would go to the A system muscles we spoke about. Rotatoris, multipli, semispinalis on the back. Okay?
그래서 우리가 때로는 또 이제 아까 말했던 3 가지 근육들이 아닐 수도 있는 거잖아요. 그래서 그때는 다른 근육도 생각을 해봐야 되는데 만약에 어떤 애가 이 움직임만으로 감별하기 힘든 상황이 있습니다. 그때는 팔테이션 테스트가 들어간다고 합니다.
Okay, now question.
아니 성이 어느 쪽이 오른쪽이 제한돼 있었나요?
오른쪽 앞쪽이 제한됐었어요. 왼쪽으로 로테이션했어요.
그러니까 저 궁금한 게 그런 거죠. 액티브 테스트 했을 때 레프트 로테이션 했을 때 리미테이션이 있는데 그때 통증은 오른쪽에 통증을 느꼈잖아요. 오른쪽에. 근데 패시브 테스트 했을 때는 통증이 없었잖아요. 그러면 오른쪽에 있으면서 왼쪽을 로테이션 시키는 액티브 머슬을 찾아야 되는 거 아니냐 이 말이죠.
그 말인 거 아니었어요?
아니 그 강사분이 말하신 거는 요걸 찾았잖아요. 왼쪽에 그걸 찾았잖아요. 스프레니스 캐피티스를 찾았죠. 지금 왼쪽으로 돌렸을 때 왼쪽에 통증이 일어나면 그게 맞을 것 같은데 왼쪽으로 돌렸을 때 지금 오른쪽에 통증이 나타났단 말이에요. 액티브 했을 때. 그럼 패시브 했을 때 통증이 없으면 오른쪽에 있는 근육 중에 레프트 로테이션을 시키는 근육을 찾아야 되는 거 아니에요 말이죠. 이해하셨나요?
He felt the pain in right side when he tried to turn to left
It
side.
was on the left side. Oh, where did you feel your pain? Excuse me. On the right side, turning to the left side. Okay.
왼쪽으로 돌릴 때 왼쪽에 통증이 있는 걸로 이해를 하고 있었습니다.
그러니까 네.
And now
Yeah.
is your question.
Yes.
His question is if we feel the pain in right side when you try to the left side, it's opposite, right?
It's possible. It's also possible that the pain is on the left side.
And in this situation, which muscle do we need to find?
You don't have to look for the muscle. You have to look, is it a part of the U system or not? I provoke a little bit, but don't think about muscles. You will not reach it. You will just reach it if you know this fiber direction, and then you analyze, is it the problem in the U system or in the A system or in the straight system? This is the task. And if you know it's a problem in the U system, you know these three muscles. And if you know it's a problem in the straight system, you know it's the longissimus and the semispinalis. And if you know it's a problem in the A system, then you know it's multifidi rotatores or it's sternocleidomastoides.
일단 이거는 시스템 다이렉션에 따른 디렉션에 따른 시스템을 구별하는 게 중요하다는 내용이었는데 한 번 더 제가 물어보도록 하겠습니다. 여기서 이거 말씀하신 거죠. 일로 돌렸을 때 그러면 여기서 여기 있으면서 일로 돌리는 어포지 사이드 근육, 액티베이션 근육을
그쵸. 그 제가 얘기하고 싶은 건 그거죠. 그게 맞는지 확인을 받고 싶은 거죠. 그러니까 우리가 상식적으로 생각해보면 오른쪽에 레프트 로테이션 했을 때 오른쪽에 통증이 있다면 오른쪽에서 뭔가 일으키는 구조물을 찾아야 되는 거 아니냐 이 말이죠.
He have an opinion, and then he wants to make sure his opinion. Opinion is we need to find the muscle have a function like make a opposite rotation. We placed in here when we find the activation muscle have a problem when we test make him rotation left side but feeling it opposite side.
아니요.
We make an we make. Can you show your thing, or you can
시뮬레이션으로
make
한번
somebody who shows, and then we can go step by step.
그다음
시험 뭘 봐라고.
네.
And you can show us again, or you?
물론
And you say what would